Hi everybody, my name is Dr. Steven Fong and I'm the Acting Deputy Chief of Medicine at Conquest Hospital. I'm going to be presenting this short video about General Internal Medicine Induction, Conquest Hospital Junior Doctors. We prepared this video to be concise and organized specifically to provide you with a quick but useful introduction to general medicine at the Conquest. This is particularly suited for the current situation with COVID, so I'm hoping this virtual video will help you get used to the inner workings of general medicine at the Conquest. First of all, a warm welcome to all of you, and I hope you look forward to progressing with your medical career in general medicine. And also a warm welcome and thank you to those of you who are redeployed to medicine to help us during these strange and difficult times of COVID. As a quick introduction to who's who, the Chief of Medicine at the Conquest Hospital is Dr. Simon Merritt. I'm the acting Deputy Chief of Medicine, and I'm also the college tutor. So my main role is to help make sure that the education and support for junior doctors is adequate. The Director of Medical Education is Dr. Mark Whitehead. We have two medical administrators, Cheryl Turner and Agnes Curtis. We have two registrars. Jason James serves as the Associate College Tutor, and Saad Kutab is the Chief Registrar. Both these roles provide a leadership aspect to the junior doctors' representation, and so they serve as your representatives for any feedback that you need to provide to the senior committee. For this video, my main objectives are to go through these 8 areas or topics, briefly touch about trust values and principles. I'm going to go through the overall structure of the wards. We're going to talk about COVID-related issues. We're going to talk about the education provisions at the trust. And then I'm going to talk about the IT systems, the medical on-call structure, some governance-related issues, and finally I'll touch on annual leave and study leave allowances and protocols. The trust values and principles are more than just things on paper that we recite. At the core of it, actually, these are basic principles that we should follow regardless whether we're working at this trust or any other trust. They're really about principles about how to work together, to carry on improving and developing ourselves and our colleagues, to treat them with respect and compassion, and to get everyone involved from any level in improving what we do. So if you really think about it, these aren't just principles that have come out. Yeah, these are things we would do as human beings and as doctors to really get the best out of each other. The structure of firms and wards at the Conquest, we are mainly divided into 8 medical wards. Trestle, McDonald, and Newington or geriatric wards. Disham is a general medical ward, which is covered by Dr. Hadid and has 8 beds that are mainly dedicated to gastro patients. Wellington is a gastroenterology ward, Baird is the respiratory ward, and James is the cardiology ward. In addition to this, we have the acute admission unit, as well as ESHT, which is the short discharge center next to AAU. And occasionally when the bed pressures are high, we have medical outliers on wards such as Cook's and Attenborough, Murray Ward, and the surgical assessment unit, or Richard Tice's. COVID preparations are very important for you to familiarize yourself with. And the COVID Intranet Hub has all the information you will generally need. So I recommend you go onto the intranet website and have a look. It will cover areas such as how to don and doff your PPE, It also has all the medical documents, such as how the ward pathways are for admission. For example, familiarizing yourself with red and amber pathways. It also has the respiratory care pathway, so you know what to do with patients who are having more respiratory compromise and might require CPAP, ITU, dexamethasone. Also, it contains resources to well-being and mental health support, which is really very crucial given how difficult COVID is, not just for patients, for ourselves. And we need to be aware that there are ways to support our colleagues and ourselves. There are also educational videos about managing COVID, not just on this intranet, but on the Grand Round website, which I've listed here. Vaccinations and lateral flow tests are available for you as well. So always inquire with us or with the medical administrators if you're unsure about how to arrange these. Vaccinations are usually done through the website appointment portal, and lateral flow tests can be obtained from certain areas of the hospital. During COVID times, one of the most difficult things is relaying important information, communicating with patients and their relatives. This is a basic principle for any doctor, but more so it's accentuated by COVID. I really strongly recommend that you read on all the information you have on the internet, and also bear in mind that the communication with your patients and relatives over these difficult times are very important. We are fully supporting you during these difficult times, and I think that's very important for all junior doctors to know. This diagram shows you the various levels of support that we are putting in place to support you. We have redeployed doctors from other specialties such as surgery and pediatrics. We are trying to balance out the ward staffing to achieve adequate staffing both on the wards and the medical take, and that will sometimes include additional doctors to the day and night as much as we can provide them. It's important that there is adequate staffing in certain areas, in particular on the medical on-call, such as the A&E red zone. I can't stress how important it is to see these red zone patients quickly so that they can be processed and sent to the appropriate wards on time. Other things that we're doing are cancelling certain elective activities so we can provide more people on the ward. And hopefully, if things settle, this is all that's needed. But we have provisions to try to increase the surge rota, extend shifts if we need to. But at the end of the day, the biggest priority is to make sure that everyone is safe and protected and supported throughout these difficult times. Even while things are busy, education is vital. And it's important that you know who your clinical and educational supervisors are. If you aren't sure, you can liaise with the Education Center or myself or Dr. Whitehead, and we will make sure that you have an appointed clinical or educational supervisor. There are various teaching opportunities available to you. We do a virtual grand round every Tuesday from 1 to 2 p.m. and the website here will list all the videos. There's always departmental teaching. For example, geriatrics normally does it on a Monday. So it's always important to check with your specialty to see where the teaching is done. There is separate FY1, FY2 and IMT teaching sessions, and we are always open to suggestions from yourself about how we can improve things. You will have medical students from time to time, and I would really recommend that you do your best to provide the best teaching opportunities to them. They are the future doctors. And remember, the best doctors are educators as well. So you yourself will improve your teaching skills by teaching them. Get involved. If you have any creative teaching ideas, we want to hear them. There are various IT systems used at the Trust. eSearcher is the main electronic system for accessing blood tests, clinic letters. You can use it to add patients onto the medical take, and you can also access Nerve Center clinical observations, Evolve, and X-rays through it. Evolve is the system used to scan written notes after the patients have been discharged from the wards or clinics, so you can access old written notes on this. Nerve Center is the newest electronic system that has recently been put in place. It's used for recording all patient clinical observations, but it's also currently used by A&E for electronic clerking, so all A&E clerkings are done through this system. This Nerve Center also ties into the Nerve Center phones which you will receive, and this is the future for this trust in terms of how we communicate with each other. Nurse center phones will largely replace bleeps on the wards, so doctors will be able to use their nurse center phones to receive communique from their nurses, to address any issues and to communicate with one another. Ensure you have your logins, and if you have any problems, you can contact the IT help desk to get a login. And there are also training videos on the Round website to familiarize yourself with things like Nerve Center. The medical on-call structures over the weekend is important to note. So there's a day team and a night on-call team. In regards to the day team, there are doctors that are mainly categorized into those that are on the medical take or on the medical wards. There are mainly 3 doctors on the medical wards, a house officer that has a 12-hour shift, and 2 SHOs that cover the wards from 8:30 to 5. On the medical take, there are 2 referring medical SHOs and an AU doctor. On top of this, a twilight doctor comes at around 1 to 2 p.m. to support the team. It's important to know that the roles are flexible, and if the medical take is busy, the ward doctors may be called to assist them, and vice versa. So the underlying principle is teamwork and working with each other, with coordination by the medical registrar and medical consultant on call to ensure that the most efficient use of the team is made. Over the night time, there is a registrar, an SHO, and an AAU doctor. When clinical pressures are high, we aim to add additional doctors to the day and night on call, and also we supplement the weekend with additional medical consultant on the wards when possible. A few topics for governance. It's important you learn how to complete a DATIX form if there are any incidents. This helps us learn from our mistakes. This is a non-blame culture. The main reason is to improve and to avoid further mistakes. I recommend you attend any audit and mortality meetings in your specialties. We have also a trust audit day as well. Ensure you complete your DVT forms and other assessment forms such as dementia forms, as these are important to screen for any problems in regards to DVTs and other medical issues. They may sound boring, but they are important. It's important to be familiar with how to complete death certificates, and you can liaise with the bereavement officers, and they're very helpful in showing you how to do that if this is your first time. We have a specialized consent form for interventional radiology procedures. It's important to note that it is the radiologist that completes the legal consent for the procedure. But as part of this specialized form, the registrar consultant who's requesting the procedure should complete the part 1, which really says things about that you've looked at other options or alternatives to the test that or procedure you're requested. So I think the important thing to say is that as junior doctors, you are not expected to consent for the procedure, but as part of the process, you need to make sure that this form is completed by your consultant and registrar, or it will be difficult for the patient to proceed to the test or procedure. So therefore, once you know that someone is going for IR guided procedure, please make sure that your senior team has completed the form. And finally, we're going to talk on annual leave and study leave protocols. This requires coordination, following the rules, and showing respect to your colleagues. Annual leave is not a given unless you follow the right procedure. A minimum requirement of 8 weeks notice is usually needed. On-calls require prospective cover, and all leave requests, swaps, sickness must be informed to the medical administrators, which are Cheryl and Agnes. We aim to support all leave requests as much as possible, but it's important that you follow the rules because that shows respect to your colleagues. It's important as we don't want to leave the wards with understaffed colleagues because of inappropriate leave being taken. And finally, I want to welcome you to general medicine here. We are going through a very tumultuous time with COVID, and it's very easy to get lost in the busyness of everything. But whenever that happens, I always remember to myself what I've set out to do, which is to save lives, to provide compassionate care to those that are dying, and to treat everyone as the great human beings that they are. If it was an easy job, everyone would be a doctor. But to me, and to many people, this is the best job in the world, despite of everything and because of everything. So I wish you good luck in your future careers in medicine, and hope to see you one time for a drink when this is all over. Goodbye.